Gerry, let's get back to you. Do you have any, I mean, a lot of questions about contracts, availability of lifeguards. What are you doing with some of your associations to adjust based on the not opening or the changes in the regular pool schedule or cycle?
Well, what I've done is I've amended contracts. So for many associations, we've amended contracts because it would go from May 23rd to September 7th this year, the entire year. Okay, so that would be 107, 108 days. So what we've done is I've amended contracts for June 1st openings, June 15th openings, July 1st openings, and July 15th openings, all the way through. So if it's phased in, if the association wants to open July 1st, so I've changed the bottom line. So I've changed the figures depending upon what service they're going to get. So if a contract was for $50,000 for the entire season, and in some instances I prorated it, and it came out as just simple math, and the association's paying what they get for. That's what I've done with many, many associations I represent.
So your suggestion is to have a conversation with your pool contractor and find out what their desires or plans are.
Exactly.
And then
Well, call your pool contractor and say, listen, we're looking at opening July 1st, and our contract, we started, our contract is for X amount of dollars for X amount of days. So we're looking to amend the contract, and they should be willing to do it because at least the way I do it, I want to build my relationships. I have relationships and I work together because this is a different period of time. So that's what we do.
What about lifeguards, Gerry? That is one concern. An individual parent may look at their child and say, you know what, let's find you another job. I don't think lifeguarding is going to be something we want to expose you to. Are you seeing any challenges with that?
So far, I have not had any pushback from parents about that. On the other hand, I've had a lot of encouragement. A lot of parents want their kids to go back to work. I already have 125 lifeguards lined up for this year. Okay, that's a little down from last year. Last year I was at about 185, but I have 2 courses going on right now, virtual courses online. And once they get the order, they'll be able, because there'll be essential service, they'll be able to do the swim portion in the pool. So we already have 40 kids lined up who are taking classes right now. We're doing virtual.
Gerry, is that for the certification? That was going to be my question. I understand there's been a lot of questions about lifeguards not being certified because their certification only lasts for 2 years.
Right, that's for the certification. So we're doing recertification and certification courses right now, virtual online, 2 different classes. And then once the governor allows pools to be open, the lifeguards will be essential workers basically, and they will be then in the pool and they'll do the water portion of their certification and the CPR part also.
Paul, if you're a parent and you're stuck in the house with a teenager for 2 months, you probably want to get them out.
Yeah, probably.
I've got 4 lifeguards for you.
Okay, please, I could use them. Okay.
am I included in that, Paul? Am I part of that? So Gerry, let's talk about the, we have questions on here to further explain that 36 and 100 square foot measurement that you referred to. Can you get into more detail? What's the difference between 36 square feet for a chair and 100 square foot for a lounge?
Because a lounge is 7 feet long, so you have to do it. So they base it on 10 foot square. So 10 squared is 100 feet, 6 squared is 36 feet. Because when you're sitting straight up, you're not taking as much space. When you're in a lounge chair, you're taking your lounge chair is longer. So that's where the additional space comes in.
So you're measuring from your foot one way and your head the other way.
Right, correct.
Okay.
Maybe Dave and Martin can comment, because we are strongly recommending that no furniture be put out and that people bring their own furniture, at least in these early stages. Clearly, all of these amenities and facilities, it is going to be modified, the restrictions as time progresses, and all of our prayers are that, clearly there will become, we will get something from the medical community to make us all feel much more safe. But until then, I think that's what we're recommending.
And I hear that all the time. Liz Commando says it every day, baby steps.
Yeah.
Do the safe things, do your due diligence, and then make decisions, and then see how that works out, and then move to the next step.
I would agree, Paul. You're reducing the risk by not having pool furniture there, and that's a good idea. If you are going to reopen, you want to, do everything you can to reduce the risk of the spread, obviously, but also insulate and protect the association.
And there's no doubt that if you have a swimming pool furniture there, you're going to have to sanitize it after every time somebody uses it and leaves.
Right. One of the things that I'd like to comment on is adults you can explain social distancing to, but once you get a bunch of children in that pool, I think you're going to have a lot of trouble trying to keep them apart. And I just think that they, you know, they know they can't hug grandma. They can't get that close to grandma, but put them all in a pool together and they're going to forget all about that. And you're going to have children playing together and they're not going to stay within their little cube of space. So that's another issue to think about.
Okay. Gerry, what are you hearing from the local health departments about doing inspections, electrical inspections, grounding inspections, and annual inspections?
Okay, so the electrical inspections are ongoing, okay? They're performing electrical inspections, you know, the 5-year or the visual inspections that have to be done every year. Those are being done. The Board of Health has taken another stance as far as Bergen County and mostly Hudson County. They are going by the 25-day checklist. So the 25-day checklist became part of the bathing code 2 years ago when it was amended. And the checklist was for the reason they didn't have to do pre-inspections. Some towns opted not to do pre-inspections because of the checklist, and you would have to, the CPO or TPO would have to fill out the checklist and fill in everything that's required, and that would suffice, and then they would do their inspection during the middle of the season or whatever time they chose. So a lot of towns that did inspections last year, they're just opting to use the 25-day checklist. So that way we don't have to worry about pre-inspections for that matter.
Okay. I'm getting a few comments on a further definition or explanation of the term monitor. Does that mean somebody rides by and looks at it? Does that mean somebody stands at the gate all day long? Small community associations don't have the wherewithal to supply a person. Can an association use a volunteer, a resident as a monitor? Is there any?
Well, we can offer that service. And if you look at it, if you alter your contract, the money you're saving on that, you shouldn't go over budget, because it's going to cost more money to run a pool this year. But if you have less days and you work with a pool management company that's amending the contract, if you already budgeted $50,000 and then your new contract's going to be for $37,000, there's $13,000 you still have budgeted. So we could use that money for a social ambassador, social distancing ambassador. If people want to volunteer, that's an association issue and maybe a legal issue also, because then you might have conflicts of some sort.
Yeah, on the volunteering side of things, I'm sure Dave might add to this. I would say don't do that, only because you're then going to be responsible as an association to train that person. And obviously then directly responsible for anything that somebody alleges they failed to do. I think you want that done by an outside vendor.
I think it's difficult for the person who's a resident to be the person who's going to say, you must do this or you must do that. You're more likely to get conflict, although we know some people will conflict with anybody. But yeah, I mean, I think keep in mind, we don't know what the rules on the pools are going to be. We suspect that they're going to include the monitoring, but at this juncture, we can only guess. We can't guarantee. So we're all going to have to just wait and then really see what it says and then offer advice.
I'd like to add something from an insurance standpoint. I think that I've heard some communities are talking about hiring maybe an unarmed security guard or something like that in a community where they do tend to have conflict. I would caution the board members on not being enforcers, because we've had some claims against board members where they've been an enforcer and maybe had to repeat that enforcement several times. And then the person goes to the police station and signs a criminal harassment complaint, and criminal acts are excluded on the directors and officers' liability. So I'm always cautioning the boards, please don't become enforcers. If someone becomes belligerent, it should be acceptable to call the police.
Yeah, I think the big challenge is going to be, as with everything, the devil's in the details. As we begin to look at the details of how we implement some of these requirements or recommendations, especially with monitoring, for social distancing or physical distancing, really people will be coming to the clubhouses for social reasons. But we, think about a clubhouse. You're going to have a monitor in every room that they have there, whether they're in the card room, the pool table room. It's going to become onerous and financially challenging for the associations. And then if we think about having those monitors be board members. You're right, that's a concern, or residents in the community. And even if we think about people doing self-monitoring, I think that can even be more challenging, because if anybody questions another individual, that has a greater propensity to escalate to a real conflict. So it's going to be very, very challenging.